Hello and welcome to the Scholar Circle, scholarcircle.org. I'm Maria Armoudian. In this hour, promise in a new COVID-19 vaccine is tempered by the huge spike of cases. What lessons will nations learn from the virus response, and when can we expect to control the pandemic?
I'm Doug Becker. The COVID-19 pandemic has reached a new high in infections across the U.S., across Europe, and around the world, in particular as the weather is turning colder. But good news is on the horizon, with the development of at least one and likely multiple vaccines. But how quickly will the vaccines be distributed? What principles will guide their distribution? And how will the pandemic change public health discourses in the US and around the world? Our panel today is Mark Peterson, professor of public policy, political science, and law at the University of California, Los Angeles. He's working on a manuscript entitled Hardball Politics, Hobbled Policy, Context, Choices, and Consequences in U.S. Health Reform. Heather Wipfli, Associate Professor of Clinical Preventive Medicine and International Relations at the University of Southern California. She is the author of numerous articles, including the Manila Declaration on Migration and Health, commentary of the Association of Pacific Rim Universities Global Health Program. I'll ask the first question of Mark Peterson. Right now, we're in a stage where cases are spiking dramatically across the United States. Congress seems to be deadlocked in any sort of a response to these increased cases, but we have this promise of a vaccine. So I guess the first question is, how likely is it that there'll be some sort of an agreement, some sort of a public policy that can manage this growing caseload in a way where the country can move forward with public health in addressing this crisis?
Well, Doug, there are many dimensions to your question there. Some have to do with just surviving economically, and that's really where the Congress has been log-jammed in ways that are very disconcerting. There simply ought to be a very significant piece of legislation that ensures that individuals don't fall through the cracks and small businesses don't get destroyed as we go forward. And we know the earlier CARES Act had worked, and more needs to be done in that direction, but it seems every day to look worse and worse. Then you've got the issue of certainly in this terrible midst of this rising number count for the pandemic, happening in a period in which we've never been so divided as a country, going at least in the last 100 years. And so trying to maneuver through that context when people become so distrustful of either side and any of the players involved has made it very problematic. And frankly, the president has failed in leadership on that issue. And then you've got the vaccine, one of the elements in which the president actually did contribute in a positive way by helping, at least helping to facilitate the rapid development of these vaccines, but further politicized that issue as well. So even the vaccine that ought to be a positive for everyone is right now caught up in all the distrust. But then you've got the fundamental managerial and production problem of how do you develop enough of the vaccine? How do you distribute it around the country? How do you prioritize among different population groups to get the vaccine, knowing that it's going to be a rollout that goes sometime between later this month and probably well towards the end of the summer of 2021. And that's going to be a major challenge, but I think there is, the scientific achievement here is so remarkable. And the capacity to address this coronavirus as rapidly as the community has with developing the vaccine ought to put some energy behind all this. One of the real problems, though, is that we really don't know what's happening in the background. The incoming Biden-Harris administration, for instance, is not getting the information for what exactly has been planned to move from production to distribution to actual, as Biden put it, shots in the arm. And that we're just going to have to see how that plays out as we finally get into the full transition and the inauguration.
Now, Heather Wipfli, the U.S. has been criticized for at least a lack of coordination, although commended, and also with international partners, at the development of this vaccine. Is the U.S. fairly atypical with the challenges it's faced in trying to develop an effective public policy in dealing with these outbreaks? Or are these issues that we're seeing in a lot of countries around the world?
Well, all countries around the world are right now having to deal with the large question about how are they going to get the vaccine? How are they going to deliver that vaccine to their population? Are they going to prioritize, and do they have the infrastructure? Every country on the planet right now is dealing with these questions. Is the United States an outlier? I think the clear answer to that is yes. From the standpoint of a high-income Western democracy, it's definitely an outlier in that it has not actively participated in the development of the international governance system that's kind of arising around the creation, the allocation, the collection, and then the allocation of COVID vaccines to lower income countries in particular. So the WHO has launched, for example, the COVAX program, which is an initiative, again, to manufacture and buy up vaccine ahead of time so that they can distribute it to very vulnerable, low-income populations around the world. And the United States is not participating in that initiative. So the absence of the United States at the global level within a number of these international initiatives to ensure that we follow a human rights and equitable, justice-driven approach to distribution of the COVID vaccine is definitely not taking place.
Yes, and Mark Peterson, one of the things that strikes me is that one of the greatest criticisms of the Trump administration in dealing with the vaccine is that they didn't secure as many doses from Pfizer, for example, that they possibly could have. And the president's response to that was to propose an executive order, the suggestion being it wouldn't necessarily have that much teeth, but at least an executive order that says that the U.S. wants to make sure to have as many doses for the U.S. Without regard to international distribution. Is that really, portending to the notion, as Heather pointed out, that the U.S. really has terribly little interest in the international impact and really just the interest in the impact here in this country?
Well, what you're seeing is the president, even in the case of a pandemic and vaccines, go to America first. The problem is, from the American first perspective even, is the executive order means nothing. It's not going to have any impact whatsoever. The real question is, when an opportunity was presented by Pfizer to buy a much larger supply to ensure that would be available in this country, why didn't the administration do that? The cynical answer is because Pfizer had not participated in Operation Warp Speed. And as you know, the president tends to favor those who go with his point of view and oppose those who don't. And another unfortunate politicalization of this process. But in the end, the other thing that's complicated here, and this is not a burden on, this is not the charge of the administration, but one of the problems is we've got a number of favorable returns on a number of different approaches to vaccines. Pfizer happened to come in first with an extraordinarily effective vaccine, but it's also a complicated one. It requires 2 shots spread out, I believe, a month in between, and it needs to be in a deep freeze for storage. So imagine what the transportation and storage problems are with that. And in the meantime, there may be not too much later from now other vaccines that are much easier to handle. And so that's going to be a complicated machination as to how you orchestrate all that. But again, none of that should be affected by politics or partisanship or the kind of polarization we have in the country. And unfortunately, President Trump and his administration have made it all the more complicated by sowing the distrust that people have towards all of these products right now.
And Heather, I know that you've done quite a bit of work in places like East Africa. Is the Pfizer vaccine even viable in places like Uganda, where the technology that would be required in order to store it and prepare it for use, it may very well be beyond the national capacity?
Yeah, the short answer is no. It's not really a viable vaccine. It's not the vaccine that the world is generally looking to distribute to the region. There's other vaccines that are under testing, that are close to the finish line, that'll be much more viable, don't have to be deeply refrigerated or frozen, and could be more easily distributed worldwide. I think just to note, though, about this idea, that Trump didn't buy enough or that we didn't buy enough, it really points to this idea that there is this race going on to purchase vaccine, and that we are in a phase of vaccine nationalism where everyone's trying to buy as much and ensure that their population will get it first. And so it's just an awkward, strange position for Americans to be in, to be told, no, somebody else got there first and bought it first. But this is a situation in which many other countries around the world, especially low and middle income countries, are very familiar with having to wait for others to get it before they are given a chance to purchase. And those are the type of issues that the Global Forum is, these different types of global initiatives are trying to address, to make sure that just the rich aren't able to buy up all the supply and leaving low and middle income countries waiting for potentially years before they get access to even enough to vaccinate their most vulnerable segments of society.
Now, Mark, one of the issues that's concerned me is the optimism around the vaccine really can undermine what is really a challenging time that we're in right now with the increase in cases and a seeming partisan divide on even simple preventative measures like wearing face masks. How can we bridge that gap to where we're not necessarily going to see this massive spike, largely as a result of personal behavior in the US that's excused by, but a vaccine is just around the corner, so we don't need to worry about that?
Well, I think there are two things. One is it's become pretty clear that the slippage over Thanksgiving has led to a significant costs in the disease spreading and the deaths that are now emerging. It's a lagging indicator, and that indicator is now looking pretty darn ugly. And the other thing about it is it spread across the country. Even the states that thought they were completely removed, or parts of states thought they were removed from the pandemic. Put those two together, and that might have more powerful messaging going into the Christmas holidays, that people realize this is not something that can be ignored, and maybe there'll be more behavioral response in a favorable way to some of these interventions, and simple things like social distancing and mask wearing. Now, the other thing is that Joe Biden has tried to say coming in, first of all, he doesn't have authority to tell people to wear masks except in federal institutions and so on. But his plea is going to be 100 days. Effectively, give mask wearing and social distancing 100 days. We know this is hard. We know it can't go on forever. But that will be the bridge between where we are now in very desperate situation to the vaccine, and maybe making it seem like something that is not infinite, that is bounded by a reasonable period of time, and that there is this prize at the end, may be enough to help mitigate some of the behavior that otherwise would be very problematic.
I might just add to that really quickly that this vaccine that we have, it's not the silver bullet, for multiple reasons. I mean, one is that vaccines don't save lives, right? The vaccine programs do, the program to actually get it out to people. And right there, we have a challenge still in thinking of how we're going to get it out to the people who need it. Another interesting aspect of this vaccine is that it doesn't stop infection. It stops symptomatic, like kind of response, right? So you don't get sick, but you still get infected. So we're still going to have asymptomatic potential spread, which makes the need for mask wearing and social distancing and all of these public health priorities need to continue as that vaccine is rolling out. We can't just have vaccines start and everyone kind of returns to normal. And that messaging on the side of public health is going to be very challenging to kind of continue to remind people that even if they've been vaccinated, they need to continue to mask for others. And we've had a really hard struggle so far in this outbreak, convincing people that they really need to act in the interest of their neighbor and the country and in the world, and not just for themselves. So hopefully, as the vaccine rolls out, we'll be more effective in communicating the need for these actions.
And I don't want to add more darkness to that story, but the other thing is we don't even know how long the vaccine will be effective. Will it be a one-time thing, or will it be something where over the years we're going to have to keep coming back and getting vaccinated again? So there's still things that we don't know. It's why we go back to it being a novel coronavirus. It's a lot of education still has to go on within the scientific community before we know how people in the population need to behave.
You're listening to Scholar Circle, scholarcircle.org. I'm Doug Becker. We're discussing how will the pandemic change public health discourses in the US and around the world. But how quickly will the vaccines be distributed? What principles will guide their distribution? Now, Heather, I know a lot of the concerns, particularly international concerns, can be traced to the current American leadership. And there's been some promise that, with the inauguration of the president-elect, that the Biden administration would be more international in their approach. I mean, one specific issue is going to be the expectation that the U.S. would rejoin the World Health Organization, and would be at least open to more international cooperation, international coordination. How much faith do you have in a new administration bringing about better outcomes? Or are these issues really much more systematic, much more structural than just who happens to be in the White House?
I think it's a little bit of both. I think that there's no question that a Biden administration will be more multilateral in the sense that they're definitely going to, recommit to WHO, maybe even increase our commitments and join that international kind of community in endorsing and joining these resolutions. And not just at WHO, but across the board in a number of multilateral institutions. But many of the issues that are being addressed in these forums really deal with large economic approaches and interests. Things like the development of the WHO's CTAP. This is this patent pool for COVID vaccines, where they're encouraging pharmaceutical companies to waive their patent rights during the pandemic and to, really join this solidarity movement and be, collaborative with generic drug manufacturing and really increase access and decrease prices as fast as possible. In the past, regardless of the administration in the United States has never been a big supporter of that type of approach. They've definitely defended pharmaceutical corporate interests. I don't see that changing under our current administration. Specifically, I don't see us taking that leadership in a very dramatic new direction in the way that many people, I think, would hope, at least internationally, towards more of a justice human rights framework for access to the vaccine.
Now, Mark, at the beginning, you had kind of separated out what's the economic question versus what some of the public health issues are. And that's valuable in conceptualizing it, but they really are tied to one another. The difficulty of some of the stay-at-home orders, some of the lockdown provisions that places like, for instance, Los Angeles County, where we all are trying to implement. What makes that so difficult is the lack of financial assistance for those who would be affected by those decisions. Do you think that the spikes in cases and the clear impact of the Thanksgiving holiday is going to break that deadlock? And will that economic incentive be enough to where we can actually start to stem the increase in these cases? Or are we going to just kind of have to ride this out and realize that we're going to have a bit of a disaster before things get better?
Well, so much depends on whether or not the federal government and the state government are able to provide resources to help individuals and businesses, renters and mortgage payers make their way through this. And one of the fundamental problems, of course, is even if there weren't any version of a stay-at-home policy or a lockdown, the disease would take care of that. If it spread even more wildly, people aren't going to go to restaurants. They're not going to do the things that these businesses need people to do. So there really is a very integrated relationship, as you pointed out, Doug, and they can't be separated, but they can be separated in the sense of there are two different tracks of public policy, which is to provide the resources to allow it for people to make it through without financial disaster, while at the same time supporting the public health provisions and the vaccination process to make it possible to get to a point where we can get a little more flexibility economically. But it's pure fantasy for people to think, oh, if we just let this go, then everyone will flow to restaurants and those businesses will be fine. It just won't be the case. And so there really one has to strike a very good balance. But part of the other thing too, and here's where the the learning process of science becomes so important is when this all really started to unfold in the spring, the response was to just try to close things down with a hammer, if you will. Well, now we know a lot more. We know more about how to really mitigate risks. We know how to give people the tools to think about their own risks within a particular environment, so they don't have to just hover enclosed in their homes, but there are certain things they can do with a fairly modest degree of risk or low risk, other things more risky. We know that the youngest children apparently are much less prone to get infected and to carry that infection on others, so we can keep daycare and elementary schools open in ways that we didn't know we could do back in the spring. We need to be much more adept now at targeting what we do and altering the kinds of behavior that are most risky and allowing more to go on that's less risky, so that in fact, one, you get the opportunity for economic capacity, but two, you also instill or you create greater trust in people with their sense that decision makers are really making informed, thoughtful decisions that are not simply cavalier and shutting down the entire economy.
So, Heather, I teach a course in international relations. We covered the World Health Organization. It seemed like one of the criticisms of any piece that I had assigned was that the World Health Organization was limited by the Westphalian system, was limited by this notion of national sovereignty. And in particular, this coronavirus has demonstrated the globalized world and the need for international responses because, you know, obviously national borders do terribly little towards stopping the spread of this virus. What's the likelihood that the World Health Organization will be strengthened and there'll at least be some degree of challenge of national sovereignty as a result of this virus, in particular because you've spoken of vaccine nationalism, which suggests the opposite is likely to happen?
I really don't have a secure answer to that, or whatever I say, it probably will be the opposite. But I have to say, you know, thinking back to the SARS outbreak, which was really Mother Nature's warning shot across the bow to the whole world about what was coming. And after SARS, the member states of the World Health Organization did come together, did revise the WHO's pandemic response strategy, did give it more power to respond. And in many cases, those alterations have helped in this current outbreak. But the bottom line is that many of the commitments that member states made on paper in terms of power to WHO have not materialized. And that in the end, once the pandemic was underway, countries became exceptionally isolationist, exceptionally focused on making sure that their population are buying up vaccine in secret, all kinds of things against the initiatives of WHO. For example, you know, WHO did launch this COVAX initiative, which I mentioned already, to support the collection and then distribution of vaccine. There was a very large, very ceremonial launch of this initiative and a call from world leaders for $33 billion to support its implementation. And so far, out of the 33 billion, 5 billion has been raised. I mean, that's a severe shortfall. And so really what we're seeing instead is countries maybe saying that, you know, giving it lip service to cooperation and multilateralism, but in practice, they just have not been carrying through on those promises. And so when I think about the future post-pandemic, I think that there will be lip service paid to WHO. There may be some alterations on paper to WHO's powers in terms of having more access to review national outbreaks in advance or make declarations. But I don't think in practice WHO is going to come out of this pandemic any stronger than it was going in. In fact, I think that we just know now a little bit better than ever about how difficult it is for WHO to take that leadership role.
The one thing that might be, and I'm really speculating now, it might be more favorable as we go into the future, as we have more data and we're learning more about how the coronavirus had spread well before we thought it had. It was in the United States much, much earlier. And we know that now from a lot of the wastewater testing and so on that had been going on. And as you said, like, borders are meaningless in the context of a pandemic like this. And so there's going to be more and more, I think, information coming out about the extent to which we were way behind the curve on this. We didn't even know it was happening. It was already spreading across borders. And the only way to deal with something like that is to have international cooperation. And the WHO is the centerpiece when it comes to pandemics for making that happen. And so maybe if we get past this particular era in American politics, if we get past the way the Trump administration approached this issue, and we do have an administration that is more multilateral, there will be an opportunity to learn from this in ways, and having not taken the lesson of the SARS shot over the bow, now that we took 14 torpedoes right into the center of the vessel, maybe this is an opportunity that we will do better in the future.
So I will leave this with a more optimistic view that we will learn from the failures in dealing with this crisis, in the hope that the next time we have this conversation about a new novel coronavirus, that we simply will have learned from the mistakes of the past and can go forward more positively, though a recognition that that level of optimism certainly would not be reflected with the ways in which the U.S. as well as international actors have dealt with this health crisis to date. So perhaps it is, as I always like to say, hoping against reason that we learned something from this response. We've talked about the COVID-19 pandemic today with Mark Peterson. He's professor of public policy, political science, and law at the University of California, Los Angeles. He's working on a manuscript entitled Hardball Politics, Hobbled Policy, Contexts, Choices, and Consequences in U.S. Health Reform. And Heather Wipfli, associate professor of clinical preventive medicine and international relations at the University of Southern California. She's the author of numerous articles, including the Manila Declaration on Migration and Health. Thank you both very, very much.
Thank you, Doug.
Thank you.